Hello, and welcome once again to Living Better with Chronic Illness with Dr. Larry Berkelhammer. Good morning, Dr. Berkelhammer.
Good morning, Phil. Thanks for having me.
I'm glad you're here.
Thank you.
There is a section on your website in which you talk about 4 things that relate to the health of an individual. Altruism, gratitude, authentic self-expression, and social support and community. How do all 4 of these relate to your health, our health, my health?
What was the first one you mentioned?
Altruism.
Yeah, okay. I was stunned by the research. I read literature, I do literature reviews. I read about psychoneuroimmunology and psycho-oncology and applied psychophysiological regulation. I like to read the studies. I don't perform studies, but I love to read about them because I like to know where's the evidence for claims. And I was stunned when I saw that people who do volunteer work, people who engage in altruistic activities, tend to be healthier than other people. And when I first started reading these studies, I thought, there must be some mistake here. And I looked at the studies again. I realized, no, this is after controlling for the variables. They found that there is something about reaching out to help a stranger. There is something about doing volunteer work, organized volunteer work. Those people who practice altruism are healthier. They've looked at studies where the study was designed to look at something else. And in going about controlling for the variables, one of the confounders they found was altruism, because they found that that by itself improves health. And I don't know, and I don't know that it is known. I don't believe it's yet known why that improves health.
Chemically or physiologically, they don't know yet.
I know it improves our biochemistry. I don't know the specifics of it.
How about gratitude?
Gratitude. There are a lot of life coaches, a lot of psychotherapists, counselors, and other people who now give their clients gratitude practices because they have discovered that it improves the person's state of mind, it improves how they feel about themselves. The interesting thing is, there are studies that also show that gratitude improves health. This is another one of the confounding variables, that people who practice gratitude have better health. I mean, it's not hard to understand it when you realize, when you think back, so imagine when you were in a vicious argument with someone. How do you feel in your body? You don't feel good. When you call up those memories, you don't feel good. Now, call up a memory of someone for whom you feel enormous gratitude. I mean, your heart just melts when you think of this person. How does that feel? It's so different. It's a no-brainer. Which one is going to be better for our health?
Right. Now, how it happens physiologically, we don't yet know.
And some of that actually is known, and I don't need to get into that here, but it's not important to know about that. It is important to know that we can choose, we have choices through every minute of the day, and if we choose to practice gratitude, call up memories, or express gratitude to people, that's good for our health. Anything that feels good is good. I should qualify that because some people feel good taking drugs, recreational drugs. Might feel good, but it's not good for you. But aside from the unhealthy habits, if we have a certain way of thinking and it feels good, it's good for us. If we have a certain way of thinking and we feel tense when we think about it, that's not good for us.
Authentic self-expression and your health.
One of the people I got a lot of consultations with, professional consultations, is Dr. Lawrence Lashan. He's most famous for having written a book called Cancer as a Turning Point. And in the book, he talks about how he discovered that, well, he discovered a lot of things in working with cancer patients, cancer patients with advanced metastatic disease. One of the things he discovered is that in working with these inpatients, this was in the days when you just stay in the hospital as long as you were sick, long before managed care, he discovered that as he worked with them, they began to become a little more assertive. And he knew which patients were going to do better, which patients were going to improve their odds of recovering from cancer. The way he knew is when the patients started asserting themselves, so when the lab techs would come in, when the nurses would come in, and the patient would start to say, no, not now. He knew, even though the nurses would now get upset about those patients started to do better. In fact, there are a number of studies from the 1990s on AIDS patients and cancer patients where they discovered the ability to say no correlated with improved health outcomes. Just the ability to say no. So authentic self-expression. You know, a lot of people go through life trying to please people.
Yes.
Trying to make others happy.
Yes.
Now, it's one thing if you're trying to please people because you really genuinely get joy out of making other people happy. But if that's your job in life, that doesn't correlate with health. In fact, there are higher rates of cancer among people who do not authentically express their needs because they're too afraid of hurting people, causing pain to people. They just want to keep things smooth and stuff their feelings. That inauthenticity correlates with worsened health outcomes, especially with autoimmune disease and with cancer.
Thank you once again, sir.
Thank you.
And thank you for being with us, Dr. Larry Berkelhammer. We'll see you again.